Dr. David Lamothe was initially drawn to dentistry because the field offers continual opportunities for learning, and the chance to improve quality of life for others on a daily basis. Equipped with a dental degree from University of Texas, he entered private practice, and became an active member and leader in a number of professional associations. He has never stopped adding to his skill set and knowledge base. Today, Dr. Lamothe is pleased to bring Trudenta to the Smyrna, Georgia area. This innovative approach to balancing the bite relieves headaches, migraines, TMJ dysfunction, vertigo, dizziness, and tinnitus for many patients. In this video, Dr. Lamothe discusses how he adeptly creates individualized treatment plans consisting of an office and at-home therapies. What is Trudenta?
Trudenta is a systematic approach to solving the problem of head, neck, and jaw pain. It's been proven that over 40 million Americans suffer from some form of head, neck, and jaw pain, including migraine headaches, general type headaches, TMJ or temporomandibular joint pain, or muscle pain in the face and neck. Trudenta is a systematic approach to solving the pain issue that Americans have suffered from and people around the world have suffered from for generations. Until now, there have been options to treat different aspects of the head and neck pain issue, but there's never been a comprehensive program or system put in place to solve this problem, and Trudenta does that.
How does it work?
Well, the problem is varied, but it mainly centers around the temporomandibular joint, which is the joint here where the mandible connects to the bottom of the skull. If that joint is out of place, which is usually a result of your bite being out of balance, the joint is not happy, and it starts sending signals to fire the muscles to find a place that the jaw can be in a comfortable position for the joint. When the muscles overwork trying to find that place because of the imbalance, you begin to get lactic acid buildup, you get trigger points that actually become very painful. And over time, they start to radiate pain throughout the neck and head region, which manifests in most people in the form of jaw pain, neck pain, headaches, or migraines.
How does it help to cure migraines and chronic headaches?
How Trudenta helps solve the migraine and headache problem is that it begins by addressing the muscles. The muscles have always been neglected in the forms of treatment that we've had for migraines. We treat the muscles through light therapy using what we call a cold laser. We use microcurrent. We use ultrasound, which are all things that have been used in sports medicine and other forms of physical therapy. So what we do is treat the muscles, get the muscles quiet to the point that we can figure out where the imbalances are in the biting system. Once we adjust those areas and get your bite to where it's comfortable and the jaw joint is comfortable, then the muscles stop working and they stop referring pain and stop doing all of the things that they do, and quiets the whole system down. And therefore, you stop the headaches.
How does it help with TMJ disorders?
TMJ disorders represent inflammation within the joint where the jawbone connects to the base of the skull. when there's inflammation, the cartilage disc and the muscle attachments are all inflamed, and they tend to become painful. This Trudenta program helps to settle everything down. It stops all of the action of the muscles. It calms everything. It allows us to get to a point to where we can get the bite balanced and eliminate the things that are causing the inflammation in that joint. Once we do that, the joint will settle down. The popping and clicking and grinding noises that people hear in their joints usually is calmed down. We've got a track record of a better than 90% success rate with improving or completely eliminating the issues with the joint and the headaches and so forth with Trudenta. So once we get the muscles quieted down, we get the bite balanced, we get the jaw in its proper place, then all of the other symptoms that go along with it are eliminated.
How effective is this treatment?
We have found this treatment to be 90% effective in solving or dramatically improving the condition that most of our patients have. We get testimonials on a constant basis of people who are just ecstatic that they have been able to go for just a few days without having pain. Or as one lady said, I can't believe that I've been 4 days without having to take medication for my headache. It's just amazing. And like I said, we do have a track record of improving dramatically or completely eliminating the head and neck pain of over 90% of our patients.
Is this procedure covered by insurance?
There are a few dental insurance companies and medical insurance companies that do cover Trudenta. It would be up to the patient to contact their insurance company to find out if it actually is a covered service for them. There are many insurance companies out there, some of which do cover, some of which don't.
How many sittings we need to attend?
When we do a complete analysis and diagnosis, we usually determine that a patient will fall in one of 4 categories: level 1, 2, 3, or 4. Level 1 and 2 patients typically have symptoms such as grinding or clenching or popping in their TMJ joint, something like that, which does not involve pain. Level 3 and 4 patients have other symptoms that typically do involve pain. We find that the level 1 and 2 patients can be treated in generally 4 to 6 weeks with 1 session per week for 4 to 6 weeks. The level 3 and 4 patients, particularly the level 4 patients, will need about 12 weeks of therapy with 1 therapy session per week.
How to schedule an appointment?
We would be more than happy to schedule an appointment for a patient if they would contact our office at 770-432-1344, and that is Smyrna Dental and Implant Center. You can also go to our website, which is smyrnadental.net, and request an appointment through the website. We would set you up for a consultation and a complete analysis, including a T-scan, a range of motion, dental range of motion, cervical range of motion, and at that point we'll make a diagnosis and suggest the level of treatment that